So we feature the Pagosa Springs Medical Center. And Tamra Lavengood is back again today. She's the Director of Clinic Operations over there. And doing a great job. That's an awesome clinic, I'll tell you.
Good morning,
and
Will.
Good morning, that's right.
Yeah.
Welcome back.
Well, thanks so much for having me back. This is fun.
Yeah. So everything going well today so far?
It is. So I am here. I'm going to talk about this month of September.
Okay.
Is Suicide Awareness Month. And so I'm going to just give a little bit of background first. First of all, it's interesting that the CDC, they actually collect data, for diseases and for several things, and also for suicide. And so what's interesting is that there has been a record high, which isn't great news. I mean, after we hear weather, it's like weather, it was refreshing. And so this is tough, but then I'm going to give you some ideas of how to help, how to be aware. And that's what this month is all about, is just to be aware that suicide is something that is really prevalent. It's just a record high now of about 49,000 suicide deaths. And first of all, there was a real modest decline of suicides in 2019 and in 2020. But then in 2022, that was where there was just more gun-related suicides on record. And, that is a complication of just an increase in firearms. And, suicides, a lot of times there's attempts, but when we're using firearms, suicide is more successful. And it's just, the average daily suicides are about 123 per day in this country. It's the 10th leading cause of death in America, which is pretty sad. And second leading cause of death for ages 25 to 34, and the third leading for ages 15 to 24. So it's just telling us that, it's prevalent across the age, our age span, and it's something that we really need to be aware of. Suicide death rates in 2021 were the highest among American Indians, Alaska Native people, males, and people who live in rural areas. So it's something we really want to pay attention to and just be aware of. Suicide deaths are increasing at a fastest rate among people of color and younger people and those that live in rural areas. And many of those groups have seen an increase of about 30% just over the past 10 years. Which is a lot. So in order to create awareness and strengthen this fight against suicide, Pagosa Springs Medical Center, we are participating in a national suicide, Zero Suicide it's called, and it's an initiative, which is, it's a way that several hospital organizations have just decided that this is going to be a focus. To have zero suicide. So that would be our focus for Archuleta County. So at your clinic visit, what you will notice is that our MAs, they will take your vital signs, which are your blood pressure and your pulse and your height and weight. But just like those things, another vital sign is going to be to really look at how you're doing, mentally. That is as important as your physical health. And so what you'll get is that you will get a depression screen and a suicide screen, and it will be on just either a laminated piece of paper or it will be just on a piece of paper. And one side is a depression screen, the other side is a suicide screen. And our goal is to do this for every patient at every visit. Life changes, and even though you have just been seen in the office, maybe a month later, something has happened in your life where your whole perspective is going to change. And we want to be able to identify that and help with that and prevent, any type of harm to yourself. This can save a life. And So, just like we are looking at your blood pressure to proactively treat heart disease, we want to proactively identify suicide or that intent to really prevent you from taking your life. Currently, our clinic, since we started to do this, we have seen at least once a week, we are identifying somebody who needs suicide intervention.
Wow.
That is amazing.
Wow. For a small community like
yes,
this.
It is. But what's interesting also is that research has shown that people who actually are successful, who do commit suicide, that they have been seen by a primary care provider within the last 30 days. Like over 25% of people that are successful. So it just shows us,
a point where you can make a difference.
We really can. So primary care, we are just positioned, perfectly to really reach out and proactively identify folks that need to have intervention. So
is it a question that you ask, or questions, or?
It is. It's questions, and they're actually validated tools. They're called, and they're just questions that you answer either yes or no, and depending on the questions and how many. Not so much the order, but just how many are positive. It will tell us your risk, and it's called the CSSRS, and it's a Columbia suicide screening tool that will actually tell you, if there's no risk, or if there is a low or a moderate or a high risk. And if you're low risk, that's telling us that you've thought about it, and we're going to refer you to a behavioral health provider. And in our clinic, we have Marcia Newth, who is our behavioral health provider. She's wonderful.
She is.
She really is. And we will refer to her. And, just to have a session where you're just able to talk about what's going on in your life, that is so helpful. Now, if you're moderate or high, we are definitely going to have a referral to behavioral health. And Marcia generally comes in and will talk with you. And then what we do is we try to develop a safety plan, which is really important. We want to make sure that you don't have any lethal means in your home. I mean, most of us have guns, and there isn't a place in town for safety, to store them safely. Just away from, the individual that is contemplating suicide. So the best thing is a family member, just take them out of the house. Keep them away. Because if you have a means that is so, it's a pretty definite,
quick and definite,
yes,
right.
That, just don't have it in the house. Just have it. Keep it with your family away. Your brother, your sister that doesn't live with you. And then, you just need to have the plan of who can you reach out to and what phone numbers are available. So those safety plans, that's what Marcia will do. Our providers, because we're involved in the Zero Suicide, they're actually getting training on how to develop a safety plan. So it's important. Generally, if you are high risk, we're not going to leave you. We are going to take you, we're going to escort you down to the ER. And there we have actually the ability to have a psychiatric consultation via telehealth. And that's crucial. And then depending on how active, an individual is in terms of really carrying out a suicide attempt, you may even need to go to a safe place and, be hospitalized, go someplace to a treatment center where you can be safe. That's our main goal, is to keep you safe. So,
Wow.
I have a whole bunch of other things, Will, and then you could ask me any questions that you want.
Okay. Yeah, go ahead.
Okay, I'll just keep going.
I'm listening.
So, my role in the clinic is definitely to help prevent suicide. So, as I said, we are part of the Zero Suicide Initiative at the hospital. There are several different people that are involved. Marcia, people even on the C-suite and quality. We are just committed to really having no suicides in Archuleta County. Because the primary care clinic is really striving for a team-based care model where it's not all going to fall on the provider, that there needs to be more resources that we can just tap into right there in the clinic. We have Marcia, which we call an integrated behavioral health provider, that is there for something that we call a warm handoff, where she's available, in the pod where a provider can identify that there's a situation because there's a positive screen to be able to just grab Marcia right there and then and have some intervention. Another thing that was really cool is that we wrote for a grant. The Colorado legislature, they passed this House bill just in May of last year, and it was really with the goal of supporting and improving and really expanding integrated behavioral health in Colorado. And that it was actually funds were allocated by the American Rescue Plan Act, and those funds went to Medicaid department, and they received about $31 million for the state of Colorado to really try to expand that integrated behavioral health services, specifically in the primary care setting, because that is where there's going to be just intervention. Generally, when we are, just not doing well and, not motivated, not waking up in the morning to want to go to work, that we don't reach out to a therapist. We reach out to our doctor, our nurse practitioner, our physician assistant, whoever we go to in our primary care clinic. That is who we go to. And so if we can screen you, then we'll understand, how severe is your depression, which is really a precursor for suicide. And then even post-COVID, we have seen a huge increase in anxiety in folks. And anxiety can definitely be a precursor also to suicide. So we got this funding, which is, we didn't get $31 million, but we got a portion of it. And which is really, that is cool that here in Durango, in Pagosa Springs, right. In Pagosa, that we receive funds to help in our clinic get more positions. And so right now we are able to get another licensed clinical social worker, which we really need because we just have Marcia.
Yeah, she can't be there 24/7 or whatever.
Right. She can't be there for every incident, right? Yeah, right. And so we have it posted. So any of you that are licensed clinical social workers or know of a licensed clinical social worker, the position is open to actually start in January. Hopefully, is when we're going to be getting the actual funding for this position. And it would be a fun position. It's integrated in the clinic in primary care, and it's really meant for warm handoffs, right there available. So it's a different model. It's not where you have scheduled visits, although if we have 2 licensed clinical social workers, one will be available for those traditional visits, while the other one is available for those warm handoffs, that immediate intervention that's available right during your visit. So that is a position that we really hope that we can fill. I have to put a big plug in for that. And then the other position that we get to have open is a position called a community health advocate. And what this position will be is somebody who really understands the resources in Pagosa and understands, just the nuances of how to help somebody with food insecurity. because life events are things that cause, anxiety. They can cause depression. So those are other things that we really want to be able to identify with our folks, with our patients. Do they have transportation, issues? Do they have food insecurity? Do they have housing insecurities? Do they have, financial? Probably all of us.
Right.
But what are the resources in Pagosa that can really help us? And a lot of times, you'll be given a phone number, or you'll be given, I've, in town there's this location. Well, there needs to be more streamlined help with this. And so that's what this person will do. We're going to call him a community health advocate. It's a brand new role, and that position's also going to be posted. So any of you that really understand just the nuances of resources in Pagosa, like, for example, maybe there is a resource for food, but you have to apply for it. You have to have this application to apply for it. Well, you don't have transportation, so how do you get the application? Just those specifics
Details.
are what we really need to be able to help folks with. So those are the two positions, which is pretty cool, that we are going to have. We actually have the LCSW posted, and we're going to have the community health advocate posted probably here in the end of the year.
LCWS, was it?
LCSW,
SW.
Licensed Clinical Social Worker.
Okay.
Yeah. And that's a license. And so that's what we're
I
going for.
Yeah, they need a license. Okay, so how do they, if people are interested, you can call the hospital?
Well, actually, you can go right online. Just
online
go to
and
Pagosa Springs
apply.
Medical Center and look for employment opportunities, I think, just career choices maybe. And then they will be listed, and then you apply, and we will reach out and get an interview from you and hopefully hire you. So.
Wow, okay.
Yeah, easy to
It's
do.
that easy. So check it out. And you can Google PSMC, and it's there, right there. Pagosa Springs Medical Center.org.
That's right. That's right. So some of the other things, I can talk to you about are, since the entire month of September is, Suicide Awareness Month. So it's actually the National Suicide Prevention Month.
Okay.
I went online, and the one thing that I really liked is that this is just a really easy option. Doesn't cost any money, really, or time. Anyone can do it. And it's suggested to simply record a 15 to 30-second video promising your friends that you're going to listen to anything they need to say. And then use the hashtag suicide is preventable, or hashtag 800-273-TALK. And so that's the National Suicide hotline, and or hashtag let it out. So I just thought that was a pretty cool idea.
Yeah, I was looking too at the CSSRS questions. They're very direct. They aren't like vague, like,
No, they're not at all.
How are you feeling today?
Exactly.
It's more very direct. Like,
right, and then that's really important.
Yeah, right. And
it is. In fact, when somebody is in crisis, you're not going to know it, but you ask direct questions. Even though it's hard, you ask the person directly if they're thinking about suicide, and then listen to their answers. People with suicidal thoughts, they often feel alone. And so, be sure to let them know that you care deeply about them, and you're going to listen to what they say. Then don't keep it a secret. Even though they say, don't tell anyone, promise me you don't tell anyone, tell them that, I cannot keep this a secret, because you and I together, we need to get some help. And, I'm not a therapist. I wouldn't be able to direct them into, where to go, what to do. So I would reach out to a professional for them. If they have a plan and they really have an intent, that's when I would take my friend to the emergency room. I'd say, you know what? I'm going to keep you with me, and we are going to drive over to the ER, and we're going to get you some help. And it's really important to seek some professional help. Yeah. And what other things can I talk about? Just that lethal means, are probably the main thing. We want to just really remove the guns. As I said, there's no place in town to store them, so give them to a relative. In fact, in Archuleta County in 2020, there were 6 suicides. And we average about 5 to 6 suicides in Archuleta County every year. And we have a small population. That is something that we need to really strive to intervene. In 2021, we only had 3, which is interesting that it went down. Okay. And that was when COVID was around.
Interesting.
It is. And I'm thinking, you were, maybe not able to do things, but everyone was in the same boat. So we were all in it together. So maybe that had something to do with it. But there were 3. They were all males, all with guns, and they had alcohol on board. Alcohol and guns, those 2 things do not mix. And then just to talk about suicide in terms of where a person is, I just really want to stress that it is not their fault. They are not doing this to hurt somebody else. The brain takes us in places that we cannot control, and depression is one of those places. And even though you try everything, you try different strategies and meditation and different, just things that other people have done. If those things don't work, seek professional help. And the reason is, there are so many different antidepressants that don't have side effects that really target the elements that are in our brain to help things turn around. I just really encourage people to seek that, because it's not their fault. It's not like they're, pull yourself up by the bootstraps. That is not where you're at. And then, depression and anxiety can both really just spiral into a feeling of hopelessness. And then suicide is a way of taking away that mental pain. It is. It is a mental pain that you have where there isn't an escape. And, as friends, as family members, if you see that in somebody that you care about or know, or even a coworker, reach out to them, ask them. In fact, research really shows that people are having suicide thoughts. They feel a relief when somebody asks them in a caring way. And then, be there for them. Individuals are more likely to feel less depressed and less suicidal, less overwhelmed after speaking to somebody who listens without judgment, and then keep them safe. A number of studies have indicated that when lethal means are made less available, suicide rates by that method definitely decline, and just the frequency of suicide rates overall decline. Help them stay connected. Help them understand who their network is, who can they reach out to. You can reach out to me. This is my phone number. I'm going to check up on you. And then follow up with them. Make those phone calls. Reach out to them. Let them know that you care. So those are the things that we can do.
Thanks for that information. Wow.
Yeah.
And looking ahead to September, Suicide Prevention Month nationally. And Tamra Lavengood is here, and that's very kind of you to come here and tell our listeners about this important topic and spread the message. It's important. So
it is important.
And you guys are there, right there to help at the medical center. And
Oh, and Will, you know
clinic,
what?
Right, the clinic's open Monday through Saturday, right?
Actually, Monday through Friday.
Friday, sorry about that.
We
I don't
don't
know
have
why I
Saturday clinic yet.
Not yet. Okay.
Yeah, we're going to try to get that
Working
open
on it.
again.
Okay.
I do have the one thing
Yes.
that is a really positive takeaway, though. Okay.
Okay.
So I'm going to tell you that Pagosa Springs Medical Center, we are going to have an open house. We haven't been
Right.
able to.
Thank you.
Yeah, because
That's-
of COVID.
yeah.
And so this is a positive note to end this on.
Good.
So it's going to be Thursday, September 21st from 5 to 7, totally open to the public. We're going to have music, tours, the ambulance is going to be there, helicopter, some light appetizers, just family fun. And you can go to every area of the medical center, and it should be a lot of fun.
Mm-hmm.
Yeah.
Open house 5 to 7.
5 to 7, September
Thursday.
21st.
Nice.
Yes.
Very, very nice. Okay. Well, we're just pretty much out of time, and again, there are 2 open positions, and
2 open positions.
behavioral health specialist and community health advocate. Check out the website, PagosaSpringsMedicalCenter.org, for more information or to apply. Right?
Perfect.
Okay.
Perfect.
Thanks so much, Tamra. That's awesome.
Well,
And,
thank you so much.
Of course. And the phone number, by the way, is 970-731-3700. You can call them anytime, and the clinic is Monday through Friday. It's open right now. So, okay. We'll see you all later. Thanks for tuning in. Have a great weekend, folks.